Understanding sickle cell, hidden warning signs you need to know. Hello, and welcome back to Vital Signs. Today we're tackling an important, often misunderstood health topic that affects millions worldwide: sickle cell disease, with a focus on the most common form, sickle cell anemia. Did you know that around 100,000 Americans live with sickle cell disease, with many more affected globally? Sickle cell anemia is a genetic blood disorder that can lead to serious health complications, often appearing from a young age. What's tricky about sickle cell disease is that many early symptoms aren't immediately linked to blood health. This condition doesn't just bring pain, it affects multiple parts of the body and can lead to complications that might have been managed, or even prevented, if detected early on. In today's video, we'll dive into the hidden warning signs of sickle cell disease so you can recognize if something is off with your health or that of a loved one. Plus, we'll share some practical, easy-to-follow tips for managing this condition and improving your overall well-being. If you're new here, please subscribe to Vital Signs and hit the bell icon for more essential health insights. Ready? Let's get started. Here's a question for you. Did you know that feeling unusually tired all the time could actually be a warning sign of sickle cell disease? It's true. Many people assume fatigue is just a result of a busy life or lack of sleep, but it can actually be one of the earliest indicators that something's not right with your blood. Interested in learning more surprising symptoms? Stay tuned. How sickle cell disease affects the body. To understand these symptoms, let's first look at what sickle cell disease actually does to the body. Normally, our red blood cells are round, soft, and flexible, allowing them to flow smoothly through blood vessels and carry oxygen throughout the body. But for people with sickle cell disease, these cells are shaped like crescents or sickles. Imagine a small, curved farm tool. This unusual shape makes the cells rigid, causing them to get stuck in blood vessels and restrict blood flow, which reduces oxygen delivery to vital organs. Now, it's also important to know that sickle cell disease is inherited. Sickle cell anemia, the most common form, occurs when a person inherits two copies of the sickle cell gene, one from each parent. If someone has just one sickle cell gene, they have what's called sickle cell trait. People with sickle cell trait usually don't have symptoms, though mild symptoms can occasionally arise in extreme conditions, like intense physical stress. However, those with the trait can still pass the gene to their children, increasing the likelihood of the disease appearing in future generations. Now that we've covered the basics, let's look at some key warning signs of sickle cell disease. These can often be mistaken for other health issues, so knowing what to watch for can make all the difference. Hidden warning signs of sickle cell disease. 1. Persistent fatigue and weakness. One of the most common and earliest signs of sickle cell disease is feeling persistently tired or weak. When sickle-shaped cells block blood vessels, your body doesn't get the oxygen it needs, leading to a feeling of constant fatigue. This isn't your usual tiredness after a long day. It's an overwhelming sense of exhaustion that doesn't go away with rest. If you or someone you know feels worn out all the time without a clear cause, it's worth paying attention to, as this could be linked to blood health. 2. Sharp, intense pain, known as sickle cell crises. Painful episodes are a hallmark of sickle cell disease. These crises can happen suddenly, causing sharp, intense pain that may affect areas like the chest, joints, back, or abdomen. Pain can range from mild to severe and may last for hours or even days. Factors like stress, dehydration, infection, or sudden temperature changes can sometimes trigger these episodes. If these pain crises become frequent, it's a strong indicator that sickle cell disease may be impacting blood flow and tissue health. 3. Frequent infections. Because sickle cell disease can damage the spleen, a critical organ for fighting infections, people with this condition are more vulnerable to illnesses, especially bacterial infections. This is particularly a concern in children, who may experience recurring bouts of illnesses like pneumonia. If you notice frequent or unusually severe infections, especially in younger individuals, this could be connected to the body's immune health and may be a sign of sickle cell complications. 4. Swelling in hands and feet. Sometimes, sickle cell disease reveals itself through painful swelling in the hands and feet. This symptom, known as dactylitis, occurs when sickle-shaped cells block blood flow to these areas, causing them to become swollen and tender. This is often one of the first signs parents notice in young children with sickle cell disease, but it can also occur in adults. If swelling appears suddenly and doesn't seem to be caused by an injury, it's worth checking out. 5. Yellowing of the skin and eyes, jaundice. When red blood cells break down, they release a substance called bilirubin, which can cause the skin or eyes to appear yellow. In sickle cell disease, the red blood cells break down faster than usual, releasing more bilirubin and potentially leading to jaundice. This is especially common during or after a pain crisis. If you notice a yellowish tint in your skin or the whites of your eyes, it could be a sign that your body is working overtime to manage the breakdown of red blood cells. 6. Shortness of breath and rapid heartbeat. Because sickle cells restrict oxygen flow, the body sometimes tries to compensate by working harder. This can lead to symptoms like shortness of breath or a rapid heartbeat, even during mild activities. If you find yourself struggling to catch your breath or experiencing a fast heart rate, it could be more than just being out of shape. It may be linked to your blood's oxygen-carrying ability. 7. Delayed growth in children. In children, sickle cell disease can impact growth and development. When organs and tissues don't receive enough oxygen, they may not grow as quickly as they should. This can result in children with sickle cell disease being smaller or having delayed puberty compared to their peers. If you notice a pattern of slower growth, it's important to consult a healthcare provider who understands sickle cell disease. 8. Vision problems. Finally, sickle cell disease can affect vision. Blocked blood flow can damage the small blood vessels in the eyes over time, potentially leading to vision changes or even retinal damage. If you or someone you know starts experiencing blurry vision, eye pain, or increased sensitivity to light, this could be a symptom of sickle cell disease. Vision problems are often overlooked, but they're an important sign that sickle cell may be impacting more than just blood. Managing sickle cell disease. Practical tips. Recognizing these symptoms is the first step, but there are also steps you can take to manage the condition and maintain a better quality of life. Here are some practical tips that can help support your health if you or someone you know has sickle cell disease. Stay hydrated. Dehydration can make sickle cell crises worse by increasing the chance of blood cells clumping together. Make it a habit to drink plenty of water throughout the day, aiming for at least 8 to 10 glasses to keep your body hydrated and your blood flowing smoothly. Get plenty of rest and manage stress. Stress and overexertion can trigger pain episodes, so it's crucial to get enough rest and find ways to manage stress effectively. Practicing good sleep hygiene, engaging in relaxation techniques like meditation or deep breathing, and setting realistic limits on physical activities can help minimize pain episodes. Eat a balanced, nutrient-rich diet. Eating foods rich in nutrients, particularly folate, iron, and antioxidants, supports blood health and immunity. Include dark leafy greens, beans, lean proteins, and citrus fruits in your meals. If you need personalized advice, consult a dietitian who can help you plan meals that best support your health needs. Avoid extreme temperatures. Sudden or extreme temperatures can trigger a sickle cell crisis. Try to dress appropriately for the weather, keeping warm in cold climates and staying cool in the heat. Avoiding sudden temperature changes and staying in climate-controlled environments when possible can also help. Regular medical checkups. Routine medical visits are essential for managing sickle cell disease effectively. Regular checkups allow healthcare providers to monitor your health, address symptoms early, and offer preventive care, like vaccinations, which are especially important for those with weakened immune systems. Gentle exercise for improved circulation. While intense physical activity might not be recommended, gentle exercise can help improve circulation and overall health. Activities like walking, swimming, and yoga are excellent choices. Just remember to stay hydrated and consult your healthcare provider before starting any new exercise routine to ensure it's safe for you. Today, we covered some of the hidden warning signs of sickle cell disease, such as persistent fatigue, unexpected pain, frequent infections, and jaundice. Recognizing these signs early can help prevent complications, and simple lifestyle changes, like staying hydrated, eating a balanced diet, managing stress, and getting regular checkups, can make a huge difference in managing this condition. By staying proactive and aware of your symptoms, you can improve your quality of life and help prevent some of the more serious complications associated with sickle cell disease. Remember, every individual's experience with sickle cell disease is unique, so it's always best to work closely with a healthcare provider who understands your specific needs. Thank you for watching Vital Signs. If you found this video helpful, please give it a thumbs up, subscribe to our channel, and click the bell icon to stay updated on essential health insights. We'd love to hear from you in the comments. Feel free to share your thoughts or ask any questions you may have. Let's keep learning and supporting each other on our health journeys. Take care, and we'll see you in the next video.